Hi friends, welcome to SML lectures. In this lecture, we will discuss about the anatomy of skull. The skull has 22 bones excluding the ossicles of the ear. Bones of the skull are attached to each other by sutures, are immobile and forming the cranium. The cranium can be subdivided into two parts. The upper dominant part is called calvaria and the lower anterior part is called facial skeleton. The bones forming calvaria are mainly frontal bone, parietal bone, temporal bone, occipital bone, sphenoid bone, and ethmoid bone. The bones forming the facial skeleton are mainly maxilla, zygomatic bone, nasal bone, lacrimal bone, palatine bone, inferior nasal concha, mandible, and vomer. Okay, first look at the frontal bone. Frontal bone is unpaired bone forming your majority of forehead. Its upper part is smooth and convex, but lower part is irregular and interrupted by orbits and by the anterior bony aperture of nose. It consists of three parts: squamous part, orbital part, and nasal part. Okay, in this picture, you can see here this is a frontal bone. The frontal bone consists of three parts. The first one is the squamous part. Squamous part, it is the largest part and forming the majority of your forehead. The second part is the orbital part. It is the second largest part. It enters into the formation of the roof of the orbit and the nasal cavities. The third part is the nasal part, which is the smallest part. It articulates with the nasal bone and frontal process of the maxilla to form the roof of the nose. The frontal bone is articulate with the parietal bone at coronal suture. Sutures are fibrous joint. They are held together by fibrous tissue and are immobile. Anteriorly, we have coronal suture. It lies in the coronal plane. It separates the frontal bone with the parietal bone. Lining the midline, we have the sagittal suture lies in the sagittal plane. It separates the two parietal lobes. Okay, this is the frontal bone. Its upper part is smooth and convex, and the lower part is irregular in shape. The upper part is called squamous part of the frontal bone. This part is the orbital part, which entails the formation of the roof of the orbit and the nasal cavity. And this part is the nasal part, which is the smallest part of the frontal bone, and it articulates with the nasal bone and the frontal process of the maxilla to form the roof of the nose. Okay, the next bone is the parietal bone. Two paired parietal bones articulate with each other in the midline at the sagittal suture. The parietal bone articulate with the unpaired occipital bone at the lamboid suture. Laterally, it articulates with the temporal bone at the squamous suture. In this picture, you can see here the parietal bones are highlighted in green color. The two parietal bones are articulate with each other at the sagittal suture. In this picture, this is the posterior view of the skull. The parietal bones are articulate with the unpaired occipital bone at the lamboid suture. This is the lateral view of the skull. Here, the parietal bones are articulate with the temporal bone at the squamous suture. This is all about the frontal and parietal bones. In next video, we will discuss about the temporal and sphenoid bone. Thank you for watching.